Hi everyone, good evening. Am I audible? If I'm audible, can I see a thumbs up, please? Good evening, Mahak. So, if you're joining the session for the first time, this is Dr. Shanmugapriya, an Unacademy educator for Biochemistry. Thank you, Mahak. And I'm working as professor and head of the Department of Biochemistry at Government Thoothukudi Medical College. And this is a session on electrophoresis. Good evening, S. In this session, I will be telling you about the principles of electrophoresis, not completely theoretical, it will be MCQ based. So after we discuss the principles of electrophoresis, I will also help you understand the basics by which you can answer an MCQ related to electrophoresis, wherein they may give you a pattern of electrophoresis, they can ask you how to interpret it. So that will be discussed after that, and then I will be telling you about the various types of electrophoresis. What is SDS-PAGE? Thank you, Prachi. Good evening, Rahul. So I will be telling you also about the various types of electrophoresis, starting from SDS-PAGE, sodium dodecyl sulfonate electrophoresis, what is reducing type of SDS-PAGE. So all those basic concepts will be discussed today. Okay, so that's general introduction or basics of what we are going to discuss today. And now let's start discussing. Let me first tell you about Unacademy's plans. So there is a limited time offer till August 26th. There is an Unlock 20 plan, wherein you get 20% off on NEET PG iconic subscription, and for plus subscription there is 15% plus 20% discount. So try to avail this offer, and to use this tomorrow will cover the basics of the subject of MBBS. Yes, Mahak, you're right. Is the volume low? I am able to hear myself. Can you hear me? I think it's audible. Harshita, can you check the audio from your side? Others, can you please confirm? Okay, I'll try to be a bit loud because everything is fine here, if I'm right. Yeah. Hi, Rahul. Audible? Thank you. So, so that's about the 20% subscription plan. And to avail the subscription plan, if you want an educator's code, you can use my code. My code is C Shanmugapriya. We can still hear you clearly. Thank you. Thank you. So this is my code. Okay. And then we have a NEET PG 2023 integrated and system-wise batch, and this batch is starting on August 25th, that is tomorrow. In this batch, all educators will be integrating preclinical, paraclinical and clinical subjects, and it happens in 3 modules. The first module starts from August till October, and in this module integrated clinical revision will be done, and we will also be discussing MCQs and long form case discussion. And module 2 starts in October and ends in November. Module 3 is about image based questions. So try to enroll yourself for this course because it will be completely clinically integrated session. Shall we get the PDF of this class? Yes, you will get the PDF. You will get the PDF on my Telegram group or on the Unacademy platform. Both ways you can take it. Okay. And there is a question bank 2.0 which is coming soon, which will help you in excelling in any NEET PG related exam, because in this there will be 18,000 plus brand new questions. There are 75%, most of these questions are case based and they are clinically integrated. So let's start discussing MCQs now. This is the first question for today. Electrophoresis separates proteins based on all except. Can all of you try answering this? Can I see the live chat to be active? Electrophoresis separates proteins based on all except charge, molecular weight, size and shape. What do you think is the right answer? Electrophoresis, yeah, S says it is D, Iqbal says it's D, Prachi says it's B. Shape, most of you say it's shape, right? Actually, it separates proteins based on all except the answer should be size. Yeah, the answer should be size. I will tell you why. It is because of the principle that is involved in electrophoresis. What do you think is the principle that is involved in electrophoresis? It's a very simple principle. Any charged particle can move in an electrical field. Don't we all know that? Yeah, any charged particle can move in an electrical field because if it's positively charged, You know, electrical field is created by a negatively charged electrode and a positively charged electrode. In that case, if there is a positively charged particle, where will it move? It will move towards negatively charged electrode. If it's a negatively charged particle, it moves towards positively charged electrode. So what is that? You know, any charged particle can move in an electrical field. And the rate of migration of a charged particle in an electrical field V is given by Z by F. So all of you try to memorize this formula. The velocity of a charged particle in an electrical field is given by V is equal to Z by F. You don't have to write anything. The PDF will be provided to you. So try to utilize your time now to understand the fact and to understand the concepts. Okay. So where Z is the charge and F is the frictional coefficient. And this frictional coefficient is determined by shape and molecular weight. It is determined by shape and molecular weight. Do you think it's a very complex formula, difficult to understand? No, right? What do you think will happen when a particle is more charged? When a particle is more charged, it will rapidly move towards the oppositely charged electrode. So velocity and charge will be directly related. That is why charge is placed in the numerator. Tell me what will happen when a particle is heavy. Yeah, when a particle is heavy, it cannot move, right? So velocity and molecular weight will be inversely proportional. That is why molecular weight is placed in the denominator. So what are the three determinants based on which a charged particle will move in an electrical field? Number one is number of charges, number two is molecular weight, and number three is shape. Is that clear to all of you? Yeah, now can you try answering this question? Electrophoresis separates proteins based on all except. What would be your answer? Your answer should be size. Okay. Now the next question. So this is how an image based question can be asked. So what you're seeing here is an electrophoretic separation pattern. Okay. And the question is, in the serum protein electrophoresis pattern provided, all the following proteins are found in the band denoted by the red arrow except. So they are asking you what are the proteins which are present in this band, or in other words, all the proteins are present in this band except what? So if you are given such a question, the first point that you should see is where is the arrow? Yeah, this is the arrow, but apart from this, do you see a smaller arrow present here? Yeah, and they've written it as point of application. So the first fact that you should observe is where is the point of application? Now from the point of application, the farthest band, the band that is present farthest from the point of application is the albumin band. Do you all understand this? The last band from the point of application is albumin band. And the one after that is, do you see a small or a narrow band here? That is alpha 1 band. And this is alpha 2. Okay, albumin, alpha 1, alpha 2, beta, and a diffuse band that you see here, that is the gamma band. Have you understood how do we mark it? So the first fact that you should see in an electrophoretic separation is where is the point of application. From the point of application, the extreme band, that is the albumin band. After albumin, it is alpha 1, alpha 2, beta and gamma band. Okay, and to answer this question, you should understand the basics of the separation. Okay. And usually protein electrophoresis is done on a glass slide. Can you see that here? Yeah, you take a glass slide like this, and this is where you apply a support medium. When I say support medium, it will be agarose. Have you all heard of agarose? Yeah, agarose medium is applied on the glass slide. And towards one end of the glass slide, you apply the serum or plasma protein of which has to be separated by electrophoresis using a micropipette. So what you see here is, do you see, hi Captain Jack Sparrow, meeting you all after a very long time. So do you see a red line here? That is that represents serum or plasma protein of which has to be separated by electrophoresis. And then you place this glass slide on an electrophoretic tank. Okay, this is how an electrophoretic tank would look. So you place a glass slide on an electrophoretic tank and you fill the electrophoretic tank with an alkaline buffer of pH 8.6. Can any one of you try to understand or try to reason out why alkaline buffer is added? Yeah, it is because when you drop all these proteins in an alkaline buffer, they try to neutralize the alkaline pH. To neutralize the alkaline pH, they give off all their H+. When they give off all their H+, what charge will they carry? They all now become negatively charged. So what is the reason behind you adding alkaline buffer? It is to give uniformly negative charges to all the proteins. After you give negative charges, you connect this electrophoretic tank to an electrical supply. Close to the point of application is connected to a negatively charged electrode. The opposite side is connected to a positively charged electrode. It is quite logical, right? Because all these proteins are negatively charged. Close to the point of application is connected to a negatively charged electrode. The opposite side is connected to a positively charged electrode. So when you apply the electric current, because all these proteins are negatively charged, they start moving towards positively charged electrode. The migration here is affected by 3 factors. Can you all type down the 3 factors? Yeah, the 3 factors based on proteins migration will be affected would be number 1 charge, number 2 molecular weight, and number 3 shape. That way all your plasma proteins get segregated into 5 bands. Can you see that here? All your plasma proteins get segregated into, very good Mahak, good. They get segregated into 5 bands, and as I told you previously, the band that is present farthest from the point of application is the albumin band. Why is albumin the farthest? Good Pragya. Why is albumin the farthest? It is because albumin has got the least molecular weight, so it can quickly migrate. That is one reason. And the other reason is it has got the highest negative charges. Because it has got the highest negative charges, it rapidly moves towards positively charged electrode. So which is the band that is present farthest from the point of application? Albumin, because of 2 reasons. One is it has got the least molecular weight. Second one is it has got the highest number of negative charges. And after albumin band, it is alpha 1 band. And then you have alpha 2, beta, and finally it is gamma band. Yeah. So finally what is it? It is gamma band. So what are the proteins that are present in alpha 1 band? Can all of you type in the chat box any proteins name which you can recollect which has got a prefix alpha 1? Any protein prefix has got alpha 1. It has got alpha 1 antitrypsin. Yeah, alpha 1 has got alpha 1 antitrypsin. Alpha, very good Saurav, excellent. Yeah, alpha 1 antitrypsin. Alpha fetoprotein, very good Pragya, I'm very happy that all of you are active, good Mahak. So alpha 1 antitrypsin, alpha fetoprotein, and transthyretin. So tell me what are the proteins which are present in alpha 1 band, please repeat it. Alpha 1 band has got alpha 1 antitrypsin, alpha fetoprotein, and transthyretin. And then you have an alpha 2 band. What are the proteins which are present in alpha 2 band? Alpha 2 band has got alpha 2 macroglobulin. Okay, it is alpha 2 macroglobulin, ceruloplasmin, and haptoglobin. So what are the 3 proteins present in alpha 2 band? Alpha 2 macroglobulin, ceruloplasmin, and haptoglobin. Okay, so this image or this slide is for your visual memory. Try to have a look at it. Alpha 2 macroglobulin, ceruloplasmin, and haptoglobin. And then you have a beta band. What are the proteins present in beta band? It is beta 2 microglobulin, alpha 2 macroglobulin, beta 2 microglobulin, and transferrin. Okay, beta band has got beta 2 microglobulin and transferrin. And finally you have a gamma band. What are the proteins which are present in gamma band? Please, can you try to logically think and tell me what are the proteins which are present in gamma band? Gamma band will obviously have gamma globulins. What are gamma globulins? Immunoglobulins. Very good. Gamma band will have immunoglobulins or antibodies and fibrinogen. So what are the proteins present in gamma band? Immunoglobulin and fibrinogen. Okay, so are you clear about this? Yeah, so alpha 1 band has got alpha 1 antitrypsin, alpha fetoprotein, and transthyretin. Alpha 2 band has got alpha 2 macroglobulin, ceruloplasmin, and haptoglobin. Beta band has got beta 2 microglobulin and transferrin. And finally gamma band has got immunoglobulins and fibrinogen. So Rahul has got something to say about Benz-Jones protein. And Pragya has something to say about M-spike. Very good. So M-spike and Benz-Jones protein, both these are features of multiple myeloma. So all students are watching this session, please have this in your mind. The only diagnostic application, the only diagnostic application of protein electrophoresis is multiple myeloma. Okay, because what is multiple myeloma, all of you? Multiple myeloma is a plasma cell neoplasia wherein there is excess production of an antibody. So when there is excess production of antibody, which band will get affected in multiple myeloma? Antibody is seen in the gamma region. So in multiple myeloma, which band gets affected? It's a gamma band which gets affected. Okay, and that is M band, about which I will tell you in the next question. Okay, and what about Benz-Jones protein, which Rahul has answered? Benz-Jones protein is nothing but the light chains which get excreted in urine. Okay, when there is excess production of antibody, there will be disproportionate synthesis of light chains and heavy chains. So light chains, when they don't find heavy chains to go and get integrated with, they will be found free in the plasma. And because light chains molecular weight is very less, they get filtered along the glomeruli. So they will be found in urine. So those light chains which are found in urine in a case of multiple myeloma is called as Benz-Jones protein. Is that clear? So these are the facts that you need to know about multiple myeloma. For now, if you know this, that's enough. I will tell you about this in the next question. Okay. So now can you answer this question? First, try to find out which band they have marked here. So this is the point of application. So the band that is farthest, this is albumin band. And then it is alpha 1. So the band that is marked here is alpha 2. So tell me, what are the proteins which are present in alpha 2 band? All of you answer this. Alpha 2 band has got alpha 2 macroglobulin, ceruloplasmin and haptoglobin. So what is the right answer here? Yeah, the right answer here is antitrypsin, because antitrypsin is seen in which band? It is seen in alpha 1 band. Okay. I hope it's clear to all of you now. Good. Very good, Saurav. So the next question is, good. The next question is, clotting factor that is present in serum is. What do you think is the right answer here? The clotting factor that is present in serum is. This has been repeatedly asked in NEET PG. The answer for this question is factor 7. Okay, clotting factor that is present in serum is factor 7. So first let me tell you the differences between, very good Rahul. I will now tell you the differences between serum and plasma. What is the difference? Good Pragya, good Mahak, excellent. So what is the difference between serum and plasma? Listen to this carefully. If you collect a blood sample in a tube in which you have placed an anticoagulant, what separates above is called as plasma. Do you understand this? Just for your remembrance, yeah, if you collect a blood sample in which you have placed an anticoagulant, what separates above is plasma. So what is serum? If you collect a blood sample in a simple tube, the negative charges of the tube will stimulate in vitro clotting. After in vitro clotting, what separates above is called as serum. So serum is something which separates after clotting. So clotting factors will get used in the clot. So serum does not have clotting factors. Are you clear about this? So what is the difference between plasma and serum? Plasma separates after you place an anticoagulant. Serum separates after clotting. So serum does not have clotting factors. So serum does not have fibrinogen. Do you understand this? Serum does not have fibrinogen. Still, serum has got one clotting factor, which is factor 7. Why is it so? Because factor 7 is related to which pathway? Factor 7 is related to extrinsic pathway. Don't you all know that? Yeah, whenever tissue factor is released, whenever tissue factor is released, you know, factor 7 gets stimulated, it becomes 7A, and that is how extrinsic pathway gets stimulated, right? So factor 7 is related to extrinsic pathway. Now what happens in vitro clotting? In vitro clotting, negative charges stimulate intrinsic pathway, wherein factor 12 becomes 12A, 11 becomes 11A, 9 becomes 9A. So it does not involve factor 7. So factor 7 is not involved in vitro clotting. That is why which clotting factor is found in serum? It is factor 7. Is that clear? Okay. So this can be asked as an assertion reasoning question. Yeah, the assertion can be factor 7 is absent in serum. What is your answer? Factor 7 is absent in serum. Is that true or false? That is a false statement. You know, factor 7 is present in serum. Okay. Reason is because factor 7 is involved in extrinsic pathway. Because factor 7 is involved in extrinsic pathway. That statement is true. Do you understand this? Assertion is false, but reason is true. Okay. The preferred sample for electrophoresis for diagnosis of multiple myeloma is. What do you think is the right answer? I hope you have all collected a blood sample for diagnosis of multiple myeloma. What kind of a blood sample do you collect? Do you collect blood sample or do you collect CSF or whole blood? What is that we do? Pragya says it's serum. Saurav says it's plasma. Abida Khan says it's plasma. Captain Jack Sparrow also says it's plasma. Beauty Dubey, that's a good name, also says it's plasma. Okay, so the answer here is serum. Okay, preferred sample for electrophoresis for diagnosis of multiple myeloma, serum. Why? Why do you prefer serum? We always write it as serum protein electrophoresis. It is because what is multiple myeloma? I told you. I said multiple myeloma is a plasma cell neoplasia, wherein there is monoclonal proliferation of plasma cells. Didn't I tell you? There is monoclonal proliferation of plasma cells in the sense there is excess production of one type of antibody. So which band will get affected in multiple myeloma? It is the gamma band which gets affected. Now my question to you is, how will the gamma band look? Will the gamma band look intense or dull? Yeah, will the gamma band look intense or dull? It is definitely going to be intense because the concentration of immunoglobulin is higher, right? Yeah, the concentration of immunoglobulin is high, so intensity of the color that you see in the gamma region will be high. So there will be an intense band in the gamma region. Now my next question is, will the band be broad or narrow? Try to answer this. Will the band be broad or narrow? Yeah, the band will be narrow. Why will it be narrow? It is because it is monoclonal proliferation. Do you understand this? Because it is monoclonal proliferation, there is excess production of only one type of antibody, and that antibody will have the same shape. Yeah, all those antibodies will have the same shape, they'll have the same number of charges, they will all have the same molecular weight. So they'll all migrate in one line and they will stand in one line. Okay, so the band will be very narrow. Do you all understand this? So what will you see in the gamma region? In the gamma region, you'll see a very narrow, intense band, and that is called as M band of multiple myeloma. So tell me, what will you call it as when there is a broad band? If you see a broad band in the gamma region, then what is it because of? It is because of polyclonal proliferation. Whenever there is polyclonal proliferation of plasma cells, then what will you see? You will see a broad intense band in the gamma region. When will you see polyclonal proliferation? Any idea? When will you see polyclonal proliferation of plasma cell? Whenever there is chronic infection. Yeah, whenever there is a chronic infection, for example, tuberculosis. Got it? Yeah. So if you see a broad band in the gamma region, that implies it's a polyclonal proliferation, which means it's a chronic infection like tuberculosis. Whereas when you see a narrow band, that is called as M band of multiple myeloma. Very good, Anil Kumar. So what will you see in the gamma region? I said gamma region has got not only immunoglobulins but also fibrinogen. Right. So by mistake, if you run plasma protein electrophoresis, you know plasma has got fibrinogen, and that fibrinogen will form the band in the same gamma region where you expect the M band of multiple myeloma. So fibrinogen band will obscure the M band of multiple myeloma. And that is why you should not run plasma protein electrophoresis. Do you all understand this? That is why what should you run? You should run serum protein electrophoresis. So in laboratory, whenever we receive a blood sample for protein electrophoresis, before we run it through electrophoresis, we take the tube, we tilt and see. Yeah, only when we see a rock hard clot, only when we see a rock hard clot, we use it for electrophoresis, which means clotting has already happened and it's a serum sample, only then we run it for electrophoresis. So tell me, what is the preferred sample for electrophoresis? It is serum protein electrophoresis, because plasma will have fibrinogen which will obscure the M band of multiple myeloma. Okay. Now, what are the other applications of protein electrophoresis? Not only for multiple myeloma, there are few other disorders where you can use electrophoresis as an add-on evidence. Okay, example is nephrotic syndrome. Can you all tell me what is nephrotic syndrome? Any idea about nephrotic syndrome? Any term or any word or any phrase that you can think of as far as nephrotic syndrome is concerned? You know, nephrotic syndrome is a leaky glomerulus, right? So when there is leaky glomerulus, all small proteins will get lost through glomeruli. Very good. Selective proteinuria. Excellent. Yes. Good. So there will be selective proteinuria wherein all small proteins get lost. So albumin will get predominantly lost in the urine. So how will the albumin band be? How will the albumin band be in nephrotic syndrome? It will be very light. As a matter of fact, all the bands in protein electrophoresis will be very dull looking. The only band which will not have lost its intensity is alpha 2 band. Why do you think alpha 2 band alone would not have lost its intensity? I said this is albumin, alpha 1, alpha 2 band. Why do you think it would not have lost its intensity? Because alpha 2 band has got alpha 2 macroglobulin. As the name indicates, it's a very large protein which does not get lost in the glomerulus, even in extreme phases of nephrotic syndrome. So what will you see in nephrotic syndrome protein electrophoresis? All other bands will be dull looking, and against this dull background there will be relative intensity. There will be relatively intense. Yeah, there will be relatively intense alpha 2 band. Do you understand this? So what is that you see in nephrotic syndrome? There will be a dull background against which you will see a relative intensity of alpha 2 band. Okay, so that's about nephrotic syndrome. And the next clinical condition wherein protein electrophoresis can be of use is decompensated liver disease. So can you tell me, what do you expect in decompensated liver disease or in cirrhosis? Hemoglobinopathies, that is totally different, Anil Kumar. That's an excellent answer. But I'm not discussing about hemoglobin electrophoresis here. We are discussing about protein electrophoresis, serum protein electrophoresis. No P, this is fixed. This is fixed. How much ever I reduce my size, this is going to be the same. Okay, this is the smallest that I can see, that I can use when I use FaceTime for OBS. Okay. So what was I telling you? I was telling you about decompensated liver disease, right? So in liver cirrhosis or decompensated liver disease, what you find is albumin beta band will get lighter. Actually, no. So what you would see in decompensated liver diseases, you know, liver is the organ which synthesizes all proteins. So when liver loses its functions, you know, albumin synthesis will get affected. So albumin band will be very dull. Okay, and when albumin concentration decreases, what will happen to serum oncotic pressure? Can anybody tell me? Good, Pragya. So what will happen to serum oncotic pressure? Decreases. Now to compensate for the reduction in the serum oncotic pressure, plasma cells will start producing their proteins. What is a protein that plasma cells produce? They start producing excess immunoglobulins. So when there is excess immunoglobulin that is produced, that will be a diffuse gamma band which fuses with the beta band. Yeah, there will be a diffuse gamma band that fuses with the beta band. So what is that you see in decompensated liver disease? It is beta gamma fusion. Do you understand this? In decompensated liver disease, what will you see? There will be beta gamma fusion because there is polyclonal proliferation of plasma cells. They start producing excess antibodies to compensate for the reduction in the oncotic pressure. So beta gamma fusion is what you see in decompensated liver disease. Is that clear? So tell me the answer for this question. What is the preferred sample for electrophoresis for diagnosis of multiple myeloma? It is serum protein electrophoresis. Okay. Now, this is the next question which I have seen in a previous NEET PG paper. Okay. What is the abnormal pattern seen in the electrophoretic pattern provided? So what is the first aspect that you should see? I told you. I said you should find out what is the point of application. Do you see an arrow here? Yeah, that represents the point of application. And farthest band from the point of application, this is albumin band. Okay, albumin band, then it is alpha 1, alpha 2, beta, and there is a gamma band. So they have also given you a clue in the image. That is why I'm always in support of image-based questions. Yeah, whenever you see an image-based questions, do not shy away from the question. Don't think it involves higher conceptual understanding. No, just look at the image, try to get clues from the image. So what they have written here is, what is that they have written here? They themselves have given you the answer, M spike. Okay, when will you see M spike? It is going to be seen in multiple myeloma. And how do you describe the M band? The M band is narrow intense band that is seen in the gamma region. Very good. I'm happy that all of you have answered it right. Good, Rahul. Good, Aruparan. Good, Dev. Very good, Pragya. Rahul Chand alone has answered it as broad intense band. Rahul, can you tell me when will you see broad intense band in the gamma region? If it's broad intense, it is polyclonal proliferation. Right? So when will you see polyclonal proliferation? Only when it is a chronic infection like tuberculosis. So broad intense band in gamma region signifies chronic infections. Okay. When will you see relative prominence of alpha 2 band? Can you all answer this? When will you see relative prominence of alpha 2 band? Alpha 2 macroglobulin will be seen in nephrotic syndrome. Okay. And when will you see beta gamma fusion? Beta gamma fusion is seen in decompensated liver disease. Okay. So can we fill up this tabular column? Yeah, if you fill up this tabular column, then you will be able to answer any question related to serum protein electrophoretic separation. Yeah, what is the first disorder that I told you? The first disorder that I told you is multiple myeloma. So tell me, what did I tell you about multiple myeloma? What kind of an electrophoretic pattern that you will see? Though you call it as M band, the whole world knows that it's an M band, but you should know how to describe the M band. How do you describe M band? It is a narrow intense band. Yeah, it's a narrow intense band that is seen in the gamma region. Okay. And the next disorder about which I told you is nephrotic syndrome. So what is that you will see? Nephrotic syndrome, relative prominence. Please understand this. There is a relative prominence of alpha 2 band against a dull background. Very good. Excellent, Mahak. Good. And the last condition that I told you about is decompensated liver disease. What is that we see in decompensated liver disease? It is beta gamma fusion. Okay. So this is the fill tabular column. So please try to get the PDF, yeah, and have a look at it again. And try to recollect all these facts every now and then, because when you watch the session, you might think you've understood all concepts, you've memorized all facts. But after some time, you tend to forget it. Okay, so please recall and revise this multiple times. So that's about clinical applications of electrophoresis. Now about SDS-PAGE. So SDS-PAGE separates proteins based on what? Any idea? This has been asked so many times in INI-CET. SDS-PAGE separates proteins based on what? The answer is molecular weight. Okay, good, Saurabh. Yes, it separates proteins based on what? Based on molecular weight. Why is it so? It is because SDS, or sodium dodecyl sulfonate. Okay, sodium dodecyl sulfonate has got a characteristic feature. But before we discuss that, can you tell me what are the three factors based on which electrophoretic mobility is affected? The three factors are, number one, number of charges. I told you, right? Number of charges. Number two is molecular weight. Number three is shape. So when you have multiple factors determining mobility, this mobility cannot be used to characterize a protein. For example, if you see that a protein migrates the fastest, yeah, you see that a protein is migrating the fastest, immediately will you say this protein is the lightest? Can you say that it migrates the fastest because it is the lightest? You cannot say that, right? Because it can be because it has got the highest negative charges. So you're not able to comment on its molecular weight based on the electrophoretic migration. Similarly, if you see that a protein does not move at all, immediately will you say this protein does not have charges? You cannot say that, because this protein might have charges, but it's not moving because it is very heavy. So are you able to comment on its charges? No. So do you understand what I'm trying to say? So when there are multiple factors which determine electrophoretic mobility, that electrophoretic mobility will not help you in characterizing the protein. Neither will you be able to comment on its molecular weight, nor will you be able to comment on its charges. Okay, and that is why you treat proteins with SDS. What is SDS? SDS is sodium dodecyl sulfonate. What is it? It is sodium dodecyl sulfonate, and it is a polyanionic detergent. Do you all understand this? It's basically a polyanionic detergent. It means it adds numerous negative charges to all the proteins. When I say polyanionic, I mean to say it adds numerous negative charges to all the proteins. So that size-based separation is ruled out. Yeah, so that charge-based separation is ruled out. For example, what did I tell you happens in electrophoretic separation? I said albumin moves the fastest when compared to immunoglobulins. Why? Why did I say albumin moves the fastest when compared to immunoglobulins? Because albumin moves the fastest because it has got the highest negative charges. So albumin has got 6 negative charges, whereas your immunoglobulin carries 2 negative charges at a pH of 8.6. Do you understand this? Albumin carries 6 negative charges, whereas immunoglobulins on an average carry 2 negative charges at a pH of 8.6. So what magnitude more negative charges do you find in albumin when compared to immunoglobulins? What magnitude more negative charges do you find in albumin when compared to immunoglobulins? 3 times more negative charges. 6 and 2 is 3 times more. And that is why you see the difference in migration caused by charges. But when you treat all these proteins, when you treat all these proteins with SDS adds 1000 negative charges to all the proteins. So how many negative charges do you find in albumin? Now it is 1006. Immunoglobulins will carry 1002 negative charges. So 1006 is to 1002 is as good as what? 1 is to 1. Yes or no? 1006 is to 1002 is as good as 1 is to 1. In that case, will there be any difference in migration that is caused by differences in charges? No. So charge-based separation is ruled out. Do you understand this? So when I say SDS is a polyanionic detergent, I mean to say it adds numerous negative charges to all the proteins uniformly. So that charge-based separation is ruled out. Okay. And when I say it is a detergent in proteomics is something which removes all higher orders of structure. Okay, detergent removes secondary structure, tertiary structure, and it retains only primary structure for a protein. And every protein carries its characteristic shape only because of its higher orders of structure. So when you treat all your proteins with SDS or a polyanionic detergent, all shape-based separation is also ruled out. Do you understand this? Because it removes all higher orders of structure, retains only the primary structure of a protein. Primary structure is like you handling a long thread. That long thread will get intertwined to form a ball. So primary structure will give all proteins only a spherical shape. So shape-based separation is also ruled out. Okay, so out of the 3 properties based on which electrophoresis separates proteins, what are the properties? One is charge, second is molecular weight, and the third one is shape. Out of these 3 properties, what have been ruled out? You have ruled out charge-based separation, you have ruled out shape-based separation. So what are you left with? All of you please answer. What are you left with? You are left with only molecular weight-based separation. And that is why we always say SDS-PAGE separates proteins based on what? Based on purely molecular weight. Okay. So can you answer this question now? I hope all of you would answer this question correctly if it's asked in NEET PG or an INI CET. Okay. So SDS-PAGE separates proteins purely based on molecular weight. Good. So this was asked long back, okay, not recently, long back when it was AIMS, this question was asked, okay, and it's an interesting question. A novel protein was expressed in a vector. It was purified and was run through SDS gel electrophoresis. The pattern of the protein migration is provided here. Okay, so what they have given you is they have shown you 3 lanes. What are the 3 lanes that you see here? M lane 1 and 2. And they've given you that M is the protein ladder separation. What do you mean by protein ladder? Protein ladder is always commercially available. So when you buy this protein ladder, the manufacturer will tell you this ladder will give you these many bands, and every band corresponds to a particular molecular weight. So that is the purpose of using a ladder. So M is about protein ladder. And lane 1 and lane 2 are non-reducing and reducing separation respectively. It was an AIMS question. Okay, so M1 1 and 2 are non-reducing and reducing separation respectively. So you should know what is non-reducing and what is reducing. So non-reducing, so what do you mean by reducing panel? It means you're treating the protein not only with SDS but also with mercaptoethanol. In reducing panel, you're not only treating the protein with SDS, you're also treating the protein with mercaptoethanol. And this mercaptoethanol is a reducing agent which reduces disulfide bridges. It reduces disulfide bridges. And all of you please tell me, what is the bridge which links individual subunits in a protein? Yeah, for example, insulin. You know, insulin has got 2 polypeptide chains A and B, right? Insulin has got 2 polypeptide chains A and B connected by disulfide bridges. Okay, they are connected by disulfide bridges. So what will happen when you treat this insulin with mercaptoethanol? Mercaptoethanol reduces these disulfide bridges to form sulfidyl groups. So individual subunits will become free. Do you understand this? As a result of this, what will happen? Individual subunits will become free. So when individual subunits become free, now look at this. Okay, so 1 is a non-reducing panel and 2 is a reducing panel. So non-reducing panel gives you 1 band, and that 1 band corresponds to which molecular weight? 150 kilodalton, which means the whole protein's molecular weight is 150 kilodalton. After treating the protein with mercaptoethanol, it started giving rise to 2 bands. So tell me, is this protein a monomer or a dimer or a trimer or a tetramer? Haumam Khan says it's a dimer. And then Mayur says 7A, 7B. What is that? 7A, 7B? Okay, Saurav also says it's a dimer. Do you all agree with them? Do you think it's a dimer? Yeah, had it been a dimer, what should be the molecular weight of the whole protein? So this subunit corresponds to a molecular weight of 50 kilodalton, and this subunit corresponds to a molecular weight of 25 kilodalton. Had the protein been a dimer, 50 plus 25 is 75 kilodalton. So the whole protein's molecular weight should have been only 75 kilodaltons. But what is that you see here? Do you see that the whole protein's molecular weight is 150 kilodalton? Yeah, the whole protein's molecular weight is 150 kilodalton, which means it's not a dimer. Yeah, what is it? It's a tetramer. Do you all understand this? It's a tetramer. Why am I saying it's a tetramer? There are 2 subunits of molecular weight 50 kilodaltons. Only then 2 into 50 will be 100. Okay, and 2 subunits of molecular weight 25 kilodaltons. So 2 into 25 will be 50. And 100 plus 50 will be 150. That is when you can account for the whole protein's molecular weight. Do you understand this? That is when you can account for the whole protein's molecular weight. So this is called as reducing type of SDS-PAGE. Do you all understand this? Yeah, do you all understand this? So what is reducing type of SDS-PAGE? First about SDS-PAGE. SDS-PAGE separates proteins based on molecular weight. That is just an SDS-PAGE. It's called as non-reducing type of SDS-PAGE. And the derivation of non-reducing type of SDS-PAGE is reducing type of SDS-PAGE, where you treat the protein not only with SDS but also with mercaptoethanol. What does mercaptoethanol do? It reduces disulfide bridges so that individual subunits will become free. And then when you run it through electrophoresis, depending upon the number of bands that you get, and depending upon the molecular weight of individual bands, you will be able to find out how many subunits are there in the protein. Suppose both non-reducing and the reducing panel gave rise to only one band like this. Yeah, suppose both non-reducing and reducing panel gave rise to only one band like this, then what is your inference? Your inference is the protein is a monomer. Do you understand this? Then the protein is a monomer. Now, after reducing type of SDS-PAGE is run, when it gives rise to two bands, do not immediately say it's a dimer. Find out the molecular weight of individual bands and add it and check if it corresponds to the molecular weight of the whole protein. If you don't see that happening, it means there are more than two subunits. Work out various permutations and combinations to find out how it can account for the whole protein's molecular weight. Okay, so this is called as reducing type of SDS-PAGE, which will help you understand protein structure in detail in terms of number of subunits. Okay, so what is the answer here? The answer here is it is a tetramer. I hope it's clear to all of you. Yeah, so that's all about electrophoresis. I've covered all questions related to electrophoresis which have been asked previously. You always learn something new in my class. I'm very happy to know that. Yes. Okay, any doubts in electrophoresis? So, you have never read this before. I'm happy that you're learning it now. So all these are practical aspects which every medico should know, because I want all medical students to participate in research. Okay, generally there is a notion or perception that Indian medicos do not participate in research. Yeah, we should overcome that stigma. Yeah, we should overcome that stigma, and for you to be able to take part in research, you should have a clear-cut idea about all these techniques. So don't think I am a medical doctor, why should I know about all these techniques? So understanding these techniques will help you understand and interpret the results. Okay, so thank you all. See you sometime later. I think there is another YouTube session on PCR which I'll be doing it in another 2 days. Okay, so see you all then. Good night.